This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Thyroactiv 100 micrograms tablet is essential for managing hypothyroidism. It helps restore hormone levels, promoting overall health. Indications and uses. This medication is primarily indicated for the management of hypothyroidism, helping to replace the deficient hormone levels in the body. It is used to regulate metabolism, support growth, maintain normal brain function, and ensure overall bodily functions are performed efficiently. Additionally, it may help in managing symptoms associated with thyroid deficiency, contributing to enhanced energy levels and improved quality of life. How it works. Thyroactiv 100 micrograms tablet contains thyroxine, which is vital for controlling metabolic activity within the body, ensuring its proper functioning. Directions for use. Take this medication in the morning on an empty stomach, at least half an hour before breakfast or as directed by a physician. Swallow the tablet whole with a glass of water, and do not chew it. The correct dosage and duration of therapy will be determined by your healthcare provider based on factors such as age, body weight, and specific health conditions. Possible side effects. Common side effects may include increased appetite, weight changes, headaches, vomiting, diarrhea, changes in the menstrual cycle, fever, heat sensitivity, cramps, and mood swings. It is important to consult a doctor if any side effects worsen. Precautions and warnings. Consult your doctor before using this medication, particularly if you have heart disease, adrenal or pituitary insufficiency, or other chronic conditions. Pregnant and breastfeeding women should also seek professional advice. This medication is contraindicated for individuals with allergies to thyroxine or those with unmanaged hyperthyroidism. FAQs. 1. What is the use of this medication? It is used for managing thyroid deficiency, hypothyroidism. 2. Can it be taken with diabetes? Yes, but inform your doctor, as it can affect blood sugar levels. 3. How should it be taken? It should be taken orally before breakfast. 4. What are the side effects? Common side effects include increased appetite and mood swings. 5. Is it safe during pregnancy? Yes, but consult your doctor. Thank you for watching this video. If you have any questions or suggestions, feel free to leave a comment below. Your health matters, and we're here to provide you with the information you need.